Yeah, do you ice it and keep it elevated?
I did it for a couple of days, but I'll tell you, besides looking both ways, I learned something, and that is I went to an urgent care facility, which was great. 2 different doctors on 2 different days saw me. I wrapped it every day. And then I thought, whatever it was, I was uneasy. So somebody suggested a wound care center. And I thought, why didn't I do that anyway? So I went to Cedars-Sinai here, I'm in LA, and the wound care center. And the guy says, I would have been nice if I'd have seen you a couple of days ago. And so he had to do a little minor surgery, extracted the hematoma surgically, did a great job. And I thought, it's something you don't think about because, you go to say an internist to get your physical and to find out, maybe do certain testings. You go to urgent care for like upgraded first aid. But if you get scratched significantly, you need to go to an expert who's seen all of these and how to do them. And I'll tell you, it's changed the way I think about it from now on. If anybody gets in an accident, I'm going to say, you go to somebody who is a trauma specialist in these kinds of things, because there's a lot to it as I saw at his office. So anyway, I'll live.
Okay, I'm looking around. There's Jeannie, there's Tori, Suzuho. Okay, we don't have quorum yet. Maybe we do 1, 2, 3, 4, 5.
Hello, everybody. Linda, John, Patty, Brent,
Hi.
Jeannie. Hi, guys.
Okay, looking for quorum.
Yeah, Marky, I think we do have quorum to start the meeting. We'll need one more person to join for us to move to an executive session, but we have some other agenda items we could get started with if you would like.
Okay, Suzuho.
Hi, Tori.
Okay, Suzuho has identified we do have quorum now. So, excuse me, we're going to go ahead and get started. I'll call the board meeting to order. Suzuho, are you able to take attendance? You see who's on? Or do I need to call everybody out?
I can, but Lindsay and Raleigh just, they'll be taking notes. So I want to make sure they can. And Karen's having some tech challenges with her video, but she is there. Just want to let you all know that as well.
Okay.
I think we can get started though.
Hi, Karen.
Hi, sorry, yeah, my camera's not working, so hello, everyone.
Time for a new computer. Okay. Do I have a motion for approval of the most recent minutes?
So moved.
Thank you, Tori. Do I have a second? Thank you, Linda. All in support, raise your right hand. Unanimous. Okay. Karen, my understanding is we're moving right into the executive session, or are we having Nan to present first?
Yeah, our goal was to have Nan present first because Nan has a limited amount of time and we wanted to give enough time for the executive session. So we're going to start with Nan and Chad presenting, and then we'll move into the executive session.
Okay, looking forward. Hi, Chad. Hi, Nan.
And with that, I think we just need a quick approval of the change in our agenda. So if we can get an approval
Okay,
of
that's
the
very
newly
true.
proposed agenda.
Do I have a motion for the change in agenda?
So moved.
Thank you, Tom. Second? Thank you, Tori, all in support? Okay, Nan and Chad,
Hi.
everybody
Thank you,
else put
Marky.
yourself on mute.
Yeah. Well, good afternoon, everyone. Board of Health. Nan Sundin, Human Services Director, and with me is Chad Federwitz, who's the Senior Services Manager and the Emergency Support Function 6 lead. I'm wondering who manages your PowerPoint. Yep, very good. Thank you. But let's not start with the last page. Let's go to the first page. Very good. So we wanted the opportunity. Well, first of all, we just wanted to say first, thank you for your service. You all have done a tremendous job keeping individuals and families as safe as possible. We Human Services and our teams are on the ground individually supporting and holding hands. on a different level from the Board of Health making policy. So we just wanted to take a few minutes, and we know how busy you are, so we'll do it fairly quickly. We can always come back to talk about what does emergency support function do? What have we been doing? What's our role? What are our successes? And then what are we working on for the fourth quarter of 2020 with COVID? So next slide. So these are the functions in an incident for emergency support function 6, which is mass care and shelter. And our job is to ensure these things. I'm just going to read them because they're all important and they're all playing a huge role in a COVID pandemic, which we really, didn't anticipate. We've mostly trained on fires and things like that. So ensuring safe and adequate shelter and housing, providing mass food and supplies, coordinating mental health response and resources, supporting people with what we call access and functional needs. So that term is formal, but what it refers to is generally people who are vulnerable, people over 60 who are disabled or otherwise abled, disenfranchised, homeless, unemployed, people who have trouble potentially navigating the system, either because of physical, emotional, or financial barriers. We are responsible for coordinating the communication out of ESF6. We're responsible for enhancing youth, family, and individual well-being. That's a big one. And ensuring the continuity of all of our human services, normal services. So we're doing all of the top 7 in addition to the human services work that we have to do that's mandated anyway. Chad, do you want to add anything to that?
No, that was good. Basically, most of the definitions for ESF6 come from language from FEMA and the federal government. So we follow that model.
Yeah, that's where some of those terms like access and functional needs, which really is a mouthful, come from. So let's go to the next slide. Thank you. So in the Pitkin ESF6, we have all of the human services managers are leads. So we trade leadership every week. And we also have leadership on the committees. We've had to build our capacity because the 5 of us, 6 of us, how many are there? 4, 5 of us couldn't handle all of it. So we actually brought in supervisors as second leads. And now we have a 3rd tier of line staff who have joined our leadership team to just help us with continuity and capacity. We meet 3 times a week to stay focused on all of that list of obligations that we have. We also have over 70 partners that participate in different ways, from school districts and transportation. We have some hospital reps, we have nonprofits, family and youth, other senior programs, youth serving programs. I'll show you the list in a second. But we convene this group, and we've been training with our ESF6 partners for years for this kind of response. They are all really busy right now doing response work, and our job is to try to coordinate it and keep people kind of in a common direction and not tripping over each other. The last is that our group manages a number of committees that are working on those specific target areas. So we have an access and functional needs group. We have a food distribution group, a homeless and housing committee, economic assistance and relief committee, communication, mental health, and then lastly, we have a committee focused on childcare and schools. From the standpoint of families, not from the school standpoint, but what do families and children and early childhood need to be successful in the pandemic? And what gaps do we need to stay on top of? So next slide. Just to give you an idea of our partnerships, you all know most of these organizations, but for example, the Access and Functional Needs Group involves our team, the Center for Independence, Senior Services, RAFTA, Single Entry Point, which is Garfield County, Mountain Valley Developmental Services, and there are others. I don't need to go through all these lists, but a big part of what we're doing is juggling the needs, the concerns of all of these people, using them as our eyes and ears, trying to coordinate funding and targeting the highest priority needs within these pillars of areas. Chad, do you have anything else to add to that? No, can't see you. Okay. Next slide. So we want to talk about some of our accomplishments, and we're excited to tell you about this. It is not uncommon that we get emails from Snowmass Village or City of Aspen. Are you doing something about this? And we're one of our big efforts for the fourth quarter is communication about all the things we're doing. But just to go through some of the accomplishments. For shelter, as most of you know or may know, the first thing we did was we had an emergency winter shelter that stood up at the Human Services Building because St. Mary's closed on, I think it was March 8th or 14th. So we provided emergency congregate shelter for 2 months at the Human Services Building. And we learned that not everyone is welcomed with the homeless shelter program, and not everyone wanted to come in because of the congregate nature of sleep and COVID. And then there are people who just don't want to come inside for whatever reason. So we started, we got approval to use the intercept lot at the Brush Creek to set up a safe outdoor space. And we did that by trying to maintain all of the requirements for social distancing. We have 12 by 12 lots or spots for each person. We have room for 22. We got bathrooms and wash stations. We keep the space filled with masks and disinfectant, and food is brought into the camp. We established 2 larger tents where they could, in the summer, get shade, and in the winter, if we stay there, they'll be able to use it as a warming hut. And we have a site manager that's a peer, and we have case managers that go in regularly, probably 4 times a week. In addition to those 2 things, we instantly got FEMA approval for public assistance non-congregate shelter. So we established an agreement with Mountain Chalet, who's been an extraordinary partner, and we can send people to the Mountain Chalet who have COVID and can't isolate safely at home, have been exposed to COVID and need to quarantine and can't do that, mainly because of crowded living situations, or are highly vulnerable. And so far, we've had 15 people stay at the Mountain Chalet for varying times. One person stayed as long as 2.5 months because of the vulnerability and age and difficulty living in a space that would not expose this person to COVID. And the last thing the county has done around shelter and housing is that the Board of County Commissioners supported I'm drawing a blank on it. The contract is with Uncle Bob, but the landlord tenant plan that was being proposed by not Valley Settlement, but and not Manaus, sorry, I'm drawing a blank. But this is where the county is providing $50,000, Eagle County provided $30,000, And this group will work on having negotiating for people who are in arrears with their rent, a third, a third, a third. Landlords pay a third, and the tenant pays a third, and then the subsidy pays a third. So we did join that effort, and and we're also working with our partners to be as clear as possible with the community and develop communication tools on where people can go for rent relief. Aspen Family Connections will support families that are in the Aspen School District with rent and other supports. The Family Resource Center of Roaring Fork will do that in the RE1 school district. And then Catholic Charities is our main contact for single adults who need rent support. We've also been communicating as much as we can about the state subsidy for property owner preservation program, where landlords can get relief for tenants, and also promoting as much as possible the all of the governor and the federal rules on a moratorium of eviction. We are all anticipating that if the eviction ban lifts, or when it lifts in January, we're going to see a slew of people losing their housing. And our partner, Aspen Alpine Legal Services, says that that already people they're not getting evicted, but their leases are not getting renewed. And it's a kind of a tricky little nuance of how it works. So we're anticipating, that growing in the community. And the only last part I want to say is we've been really successful securing funding from HUD for some of our homeless programs. And we just found out this week that we're going to get enough funding for a housing case manager to help with what HUD calls rapid rehousing for those who are homeless, who are we can put in housing with rental subsidies, and then also homelessness prevention. So those are all the things that we work on as a county, but with all of our community partners. Next slide. Chad, food.
Sure. So also wanted to point out some of the different efforts that we've been help coordinate around food distribution and supplies. So early on, we brought together a food distributor group as one of our committees, including economic assistance, senior services, Lift Up, Aspen Community Foundation, and Food Bank of the Rockies, to look at how can we better support the community and its members around access to food. And so before the pandemic, we were already in some conversations with Lift Up and other partners around strengthening the presence of the food pantry via Lift Up in Aspen. And so those efforts continued over the course of the summer and into the fall. And next week, the Lift Up Pantry in Aspen will be having its grand opening on Tuesday, with extended hours through the weekend, hours into the evening. And that would not have been possible without the months and months of work and conversations from that particular committee on how to make that happen. So we're really fortunate and proud of the work that we've done in that regard, but also about where the different kind of stand-up mobile pantries have been in the Mid-Valley, in Aspen, in the Snowmass Village, even from hearing from our different community partners as well about how to get people that food and where do we see and hear the greatest need. Nan, you want to add anything there?
No. Do you have senior service information here about the meeting?
Sure. I'm sorry. Some numbers. So over the last number of months, from the different food pantries, including senior services, every 2 weeks, we're serving about 1,500 households between the multiple food pantries and including senior services. And for us at senior services, since the second week of March or so, we've been averaging between just under 300 and just over 300 meals a week to older adults within our area. So almost across the board, we're seeing substantial increases in access to food in one resource or another.
Great. Next slide. We'll keep going because we know you're busy. One of the groups that's really moving forward is our mental health group. It's interesting because sometimes in an emergency, public health is responsible for mental health, but public health is really busy. And so we've taken the lead on mental health response by coordinating groups and trying to get groups that have not traditionally worked well together to work together, and we're having great success. We've come up with a couple of ads. Let me see, I guess, does that, if you can click on one of those links, yeah, does it, this is one of the Facebook ads our group pulled together. No sound? Okay, that was a risk. Thanks for trying that. It's Theron, and he's basically encouraging people that we can get through this together. And the theme of the mental health program is we're here to help. We are here for you. And we are stronger working together. So you'll see more ads going out. There's another one. They're generally going out on social media. The other thing that this group is doing is that in November, they are bringing an expert in to talk to mental health providers on the psychological importance of safety, which is what's most threatened in a COVID world, right? If no one is safe, like my adult daughter who's living here, who just came here from New York, is she safe or not? Just that threat raises people's anxiety dramatically. People, places, and things that were safe are no longer safe. So there's going to be a training on that for providers. And that group is really working on messaging and training for providers, and then trying to improve people's access to well-being opportunities, meditation, therapy, things like that. Next slide. We mentioned the people with access and functional needs. So those are people in particular who are vulnerable, who have COVID, who have been exposed to COVID, or who are at high risk. This is the number of referrals that our team has gotten from public health, from people who need special help because of one of those three things. We recently got a $30,000 grant from Aspen Community Foundation, because what we're finding and what you all know is that we need to incentivize people who have COVID or have been exposed to COVID to stay home. And a large number don't have wage replacement from their employer. Maybe they work 2 or 3 jobs, they were part-time, or they work under the table. So we are starting to build our capacity to support them financially to stay at home. And we're looking at establishing stronger links to Eagle and Garfield so that our public health department has places to refer when contact tracing leads them down valley. Next slide. I think you probably all know about the economic relief that we provided from March till June, over $2.3 million to over 2,200 individual households. We continue to follow who has economic assistance funding, and we promote that. And we work very closely with the Aspen Community Foundation because You all probably know, we still have almost the highest rate of unemployment in the state at 7%, I think was the last number. As well, I think we need to be well aware that we have an underemployed constituency now. People who had 2 full-time jobs now maybe have 1 part-time job. And they're getting laid off or on to different jobs, or they have piecework. So the financial situation of the workforce in Pickens County is tenuous, and we need to continue to work together to try to support them through this. And eventually, you know, there's a projection that 40% of the people who were laid off in March and April will not get their jobs back. The economy will shift, the jobs will shut down, people will learn to do with less. That's a lot of people. So we're kind of anticipating how to support that group. Just so you all know, the food assistance and Medicaid caseloads for human services have increased 60% since COVID. So we have dramatic caseload increases, which is good because it means that people are getting the medical and food support that they need. We believe there are more people who would qualify, but maybe there's some stigma or they're not sure how to access it. They've never considered accessing it before. So we're working with all of our partners to try to destigmatize and to normalize the use of this help right now. Next slide. Okay, so the last slide, I think, is our 4th quarter focus. As Chad said, the opening of, it's actually 5 days lift up in Aspen from 10 till 6, 5 days a week is super exciting. They have a site manager. So we're going to be working with them to help promote that. People can go once a week, which is great. And the mobile food pantries will continue. It's moving from the buttermilk lot to Aspen Chapel because, of course, buttermilk will be busy with ski season, they hope. Senior meal delivery. Our team is working on winterizing the safe outdoor space, which is really about trying to warm it up a bit and find some, we're gonna get some canvas tents and things that will keep people safer in the snow. Really trying to look at establishing an extreme weather shelter policy and plan. And that is generally really focused on precipitation and cold temperatures. And it's only open temporarily and then it closes again. So we're working on that. Really trying to communicate this concept of wage replacement because we don't really have a wage replacement program, but we have loss of wages subsidies, I would say, is what we're really working on clarifying for people and trying to incentivize those who need to isolate and quarantine so we can help stop the spread of the disease. We're really working on messaging. I think we talked about all of that, and then continuing to strengthen our partnerships with all of our partners, because none of this we could do without a really strong nonprofit safety net. So we're really pleased about that. I think, is that the last one? Oh, Chad, I just sort of said that the piece about all of our partnerships, like we really cannot do this alone. All of it is, it's like we have an army of nonprofit partners, and I just have to think that the Healthy Community Fund, the existence of it since 2002, has really helped us strengthen relationships with partners and has kept them at the table and really working together with each other. That's the most important thing. So that's it, I think. Do you all have questions or concerns or anything you want us to come back to talk about? Or
A quick question for you, Nan. Where is the food bank going to be located? The 5-day-a-week program?
yeah, it's been, Marky, across from Clark's in that market, like So when you drive in, there's that marketplace and then the post office and then Clark's Market.
Okay, got it.
Yeah, I'm sorry, I should know the address, but it's on Mill Street. I think it's off of Mill Street. And
Okay.
it's been there, but they've really had trouble with consistently staffing it or keeping it open, and people stopped going. So now they have a site manager. It's going to be a lot better.
Do
It's
they
on
need
Puppy,
volunteers?
it's on Puppy Smith.
Thank
Okay.
you, Puppy Smith.
Question for you. Do they need volunteers?
Yes, they are looking for volunteers.
Okay.
If you're interested, Marky, we'll get you hooked up.
Give me a few more weeks.
All right.
Sign me up, Nan.
Okay, great. Will do. Is this helpful for you as Board of Health? Did you all know most of this? We haven't had an opportunity to speak with you, so just wanted to try to make it meaningful.
I found it very meaningful. It's just a refresher. I mean, I was very knowledgeable about everything y'all doing. But on the other hand, it's a refresher, and it's just amazing to watch the community come together under Health and Human Services leadership. So very proud of you and your team and every one of the nonprofits participating and all the amazing volunteers and staff.
Thank you, Marky.
Yeah.
Hey,
Mark,
Marky,
you have-
Greg here. Oh,
Greg?
oh yeah. Hi. Sorry, Ann. We
Yeah.
came on the same. I just wanted to say that I'd heard also that Lift Up is looking for potential board members. I'm not sure they have any board members from the Upper Valley, and I think that would be very helpful for their operations up here to have someone from our community involved on that level. If anybody's interested, it'd be good to know.
I will be unemployed by
Oh.
November 16th. So
Okay, you're shoe in.
yeah, sure.
Marky?
Yes, hey, Ann.
So, yeah, and I just want to point out, Lift Up will be operating, but the food distribution at the chapel will still be Wednesdays from 12 to 2. So
Right.
got it
Great.
covered twice on Wednesdays. Nan, the Intercept lot, is that a done deal yet? Or are we still working on making that a permanent winter shelter?
The Board of County Commissioners all supported it, and I think there are a couple of more jurisdictional conversations. And then we're hoping that it will be solidified. We really need to talk to CDOT, it's their property. And so waiting on that, and then we'll move forward.
Okay, but in terms of the emergency shelter, we're still looking for that, right?
Yeah, the extreme weather shelter we're looking for, but the Housing Stability Task Group did not prioritize an ongoing nightly shelter. They thought, there were a lot of reasons for that. So we're looking more at extreme winter shelter, trying to secure some apartments or hotel rooms, and not having, a congregate shelter because of COVID.
Okay, and thanks for all the work you're doing, man. You and your partners.
Yeah, great team. Thank you, Ann.
Anyone else?
Marky and Nan, if
Yeah.
I could jump in, Greg again, just want to make sure when we had our discussion regarding the temporary homeless shelter at the Intercept lot, I think it's moving forward as Nan alluded, but I don't think we're using the word permanent because that's going to require more discussion. I think that's what I heard her say, but I just want to make sure we're clear that we haven't created a permanent facility out there.
Yeah, thank you. All of the work that we're doing that I just presented to you around housing and homelessness is really temporary related to COVID. There are desires for permanent solutions, but that's another track, right? We need a homeless shelter, people. We have a dog shelter, and I hate to say that, but that is the truth in our community. People deserve the same opportunity. So thanks for letting me put that out there.
Okay, Tori?
Thanks. Nan, I guess in the presentation right there, the mental health services that are set up in that network, I guess my question is there any more that we could, should, or need to be doing there. And I don't just mean in necessarily the service providers themselves, but do you feel like the communication to the community at large is effective right now? Are we getting the help to people that, you know, need it, but often are hesitant about seeking it?
Yeah, I think that's a good question, Tori. You know, we just now are getting an 8-hour communication specialist assigned to our teams. I know that I think there's a PIO. I don't know if all jurisdictions are still involved. I'm sure that we need help getting the word out, and somehow we need to figure out how to include all the jurisdictions on getting the word out in all the different mediums that people are using in English and Spanish.
Okay, thank you.
Yep, thank you.
Okay, any other questions? Okay, hearing none. Thank you very much, Nan and Chad.
Thank
And
you,
we'll
Marky.
continue. Huh?
Thank you.
Mhm.
Okay,
Thank you.
bye-bye.
Okay. Next item on the agenda will be an executive session. Thank you, Suzuho. So to that end, the purpose of the executive session will be to discuss negotiations of the COVID-19 testing and equipment from third parties. In order to do so, I need to have a motion. This is pursuant to CRS section 246402-4E. I'll need a 2/3 majority vote to move into an executive session. Do I
So
have a
moved.
motion? Thank you, Greg.
Seconded.
Second? Who seconded? Tori?
Jeannie did actually, but I had a discussion as soon as the second is accepted.
Okay, Tori?
Thank you. To the board members, I wanted to make a request to include the city manager, Sarah Ott, in our executive session. I think that there are some topics that might need some of that city insight, and instead of having her outside the executive session and you know, possibly sharing executive information, I would like to ask the board to support city manager Sarah Ott joining this executive session as a motion.
Okay, I have a motion. Do I have a second?
Second.
Stay.
Okay, discussion? Any discussion? Hearing none, all in support, say aye or raise your hand.
Aye.
Okay. Okay, fine. So can we link Sarah into the session?
Yeah, Lindsay or Raleigh, if you can forward that to Sarah Ott, and then Greg and
Yeah.
Jeannie, since you two had made the first and second motion, are you okay with your motions being amended, just for documentation's sake?
Yes.
Yes, certainly, as amended, yes.
Great, so we'll take that instead of Tori and Brett's first and second motion, so it's the same voting process.
Thank you.
Thank you, Suzuho.
So if you all who are a part of executive session at this time can switch over to the link that Lindsay or Zoom, I'm not sure who it comes from, sent out. I think this one came from Lindsay. And then for those who are in our audience, we'll be back once we are done with that.
Oops.
Karen? Okay, we're back in session. I'll reconvene the meeting, and we're glad you are all here. Karen, the next session is on mitigation and winter planning.
Yeah, thank you, Marky. So we're going to just focus in on mitigation, so that we have a guest with Garfield County Clerk and Recorder per our contract with them around vital records. They are to share with us information about vital records every year. And so we have that scheduled. So I'm going to focus really in on the mitigation plan. As you might all be aware, we've been watching the state dial, and our incidence rate has gone into the orange. It's been in there for 2 days. And once we're in a 3-day period with our incidence rate on the state dial, we go into a mitigation phase. And so we've been putting together a mitigation plan for the last couple weeks, just in anticipation that we might move in that direction as we've watched the trends happen across the state and across the nation. So we just wanted to highlight one policy decision within the mitigation plan for a vote for the Board of Health today. We will not go into the full document in lieu of time, but know that there are many, many other things that we have in our mitigation plan that are way beyond this policy decision that we're bringing to the board today. So we'll spend a bit of time talking about that, and then we will move into having Jean present. As far as winter planning goes, we can give you a quick timeline as far as the ski area plan. We reviewed that ski co plan with our team. We have given Aspen Skiing Company opportunity to look at our comments and make adjustments. And I believe that that plan is maybe sitting back in our court now, and we're working collaboratively with Aspen Skiing Company to get that plan submitted to the state health department. It needs to be approved by local public health, and then it goes to the state. So there's that kind of piece around Aspen Skiing Company winter planning. Certainly there's some larger scale conversations happening within winter planning. And if we have some time at the end, if people would like to know more about that, we can share those plans that we're working on collectively with other partners. So Lindsay, can you bring up the slide that just has the mitigation plan on it, or maybe just highlight the policy conversation, which is at the very top of the spreadsheet. Thank you. So if you want to just do a quick scroll, Lindsay, just so the board is aware of the mitigation plan in general. So you can see that there's a number of different things within the community liaison team, within our consumer and employee protection team, within communications that we're doing, and keep going down a little bit further. Some work that we're really trying to do around equity and outreach. And so ultimately in disease containment and control. So those are the plans that we have. Those are the plans that we have in the works. So we're going to just highlight the policy decision that we want to bring to you, as I mentioned. As you know, the governor put out a change in the state public health order, reducing informal group size to 10 people or less, 2 households at the max interacting together. The purpose of this is to reduce social distance or increase social distancing and keep their social bubbles kind of intact, right? The less people you're interacting with, and the amount of times you interact with the same people are kind of protective strategies. So having a social bubble that is, limited to a certain number of friends that you hang out with and a certain number of households you hang out with. So we would like to recommend to the board that we take that one step further. Josh can give you a little bit of information, but what we're seeing right now, and we have 11 outbreaks that we're investigating in Pickens County, is that a lot of them are related to informal gatherings, and that people, I think, just inherently, you feel safe because you're with your friends and you're with your family and you trust your friends and your family. And so you might let your guard down a little bit and take off your mask or get really close and give someone a hug. And so what we're just seeing is that there's just more disease transmission in these informal gathering spaces. And we're starting to see some fairly large outbreaks happening because of informal gatherings. So we would like to recommend that we go a little stricter than the state and go down to 5 people as our group size. And because the state order has said 2 households, we really have to stick with that. We can't be less restrictive than the state right now. So we would recommend that we limit informal group gatherings to 5 people or less, and retain that 2 household perspective. And so that's our proposal, and we can make that public health change as of tomorrow, if that is the desire of the board to go ahead and add that restriction into our current public health order.
Karen, I have a question that came from several phone calls I received from community members here in Snowmass, because our percentage is going up in Snowmass in terms of spread. And this is a situation, and there's multiple ones that have been cited here in our community, where college kids who are in their parents' home, and then they invite more people to come and do their online learning. And it kind of changes around as to who's there. And needless to say, it's individuals not from the same family. And to that end, I know of at least one household where the folks have been tested positive. The question became one yesterday with this particular caller who said, what are you going to do in terms of enforcement? They're in a private home and there's other individuals there. So where does the enforcement lie? I understand this individual also talked with our police here in Snowmass. Is this the responsibility of your staff, Karen, to get a hold of these families in these homes where this is happening?
So, you know, I think we're working sort of through a similar scenario right now where there was a large scale party that the police responded to, and trying to figure out what the enforcement strategies are around this. As you're all aware, there's, you know, we enforce on Colorado Revised Statute 25, and it's a fairly long kind of process when we do that. We're going into a civil process with court. And so we're trying to figure out what are the other avenues around enforcement. Who is the person, the party kind of held responsible? Is it the homeowner? Is it the person throwing the party? Is it the, you know, the rental person? I think there's a lot of things that we're trying to figure out. And honestly, Marky, I would say, you know, I've been thinking about the analogy of, you know, public health are the firefighters in this response, right? We are on the front lines doing the disease investigation and doing the disease control. And that's our bread and butter. That's the work that we are trained to do and the work that we continue to push forward. The more that we have to do, and if we think about a fire as an analogy, you know, when we have a whole government response, it's not just the firefighters. We have law enforcement helping with directing traffic, and we have all sorts of whole government responses coming together to address that fire. Right now, public health needs to put their energy in being firefighters and really focusing in on disease containment. If we get diverted with, you know, enforcement and those kinds of things, those are kind of those are extras for us right now. We are so focused on disease containment and the work that is core to public health. So I would just ask that law enforcement support us in some of these pieces. We can do this work, but it's going to take us much more time. We have to put our energies where they're best directed right now, and that's fighting this fire. So I think there's a combination of different things that have to happen with enforcement.
Thank you, Karen, for that answer. Let's go back to the policy issue that Karen and staff are recommending. Discussion, Brent?
Yeah, it just that, you know, there's sort of a symmetry from 50, you know, a gathering of 50 to a gathering of 10 to a gathering of 5. But I think there's also a matrix or a risk reward thing where, you know, 5's a funny number, and 6 allows, right, 3 couples, whatever. And even though the science is the science, I'm guessing that we're going to get a lot of less compliance at 5 because somebody's going to push it one more. And I think it feels better for me civically and you know, whatever the word is, from an enforcement standpoint, to incorporate that 6 number, even though it's not half of 10 exactly. somehow it seems a little more reasonable. And since these numbers are a bit arbitrary anyway, I think it might be something at least worth discussing, but that's my little thought.
Well, you shouldn't have 3 couples together.
Of course, well, yeah, look, the reality is we're going to be facing reality. And, people tend to behave in certain ways. And I think, we also have to be reasonable here. And again, going back to this enforcement issue, you don't want laws so strict that most people will disobey them. It's bad psychology. It's bad civic, from a civic responsibility standpoint. People want to behave properly, but they also kind of want to do what they want to do. So that was just my thinking. I think, again, we end up in a communication issue to try to convince the public just how serious this all is. And I've talked to a lot of people, 2 doctors actually in the last 4 days. They haven't been to a restaurant in 6 months, not once. And I'm thinking, whoa, that's a little stringent, but nonetheless. So, this is a serious thing. So this is my thoughts.
Other comments on the potential policy?
Marky, I know you alluded to this by saying there shouldn't be 3 couples, but just to clarify and make sure everyone's on the same page around that, the state did put out a new policy last week, I believe, maybe the week before, I can't remember now, but limiting their informal group sizes of 10 to only 2 households being represented in that. And so just wanted to call out, that's where your comment was coming from.
Other comments from the board?
Yes, please.
Yes.
Karen, are you saying that from what we've seen in our epidemiological tracing and studies, are you saying that there is a marked difference of transmission in events that are 9 people, 8 people, 10 people, as opposed to 5? That's the first question I would have. And then second, I would ask, in our ongoing desire to align with the state and such, would we not want to keep the message consistent and go down to the no more than 2 households at a gathering?
Yeah, sorry, I wasn't very clear on that, Troy. So yes, to align with the state on the no more than 2 households and gatherings. So absolutely keeping that alignment. Josh can jump in on the outbreaks and just what we're seeing. I think that would be helpful for him to weigh in here.
Yeah, so, the reason why we recommended 5 is that we have had 3 outbreaks recently that have involved informal gatherings, and those gatherings have all been right around 10 individuals. Whereas when we've spoken with other individuals that have tested positive and we ask about any types of gatherings that they've been to, they have not cited gatherings around, 5 people or so. So what we're saying and what we're seeing is that, the fewer the people that you're having at these informal gatherings, of course, the less likelihood that we'll see COVID spread. And I think there likely is a marked difference between 10 and 5, just based off the information we're seeing here, not just locally, but also regionally. We know that that 10 does appear to be slightly too high when it comes to just the amount of disease spread that we have in the region right now.
And for clarity, the state is still at 10 people, but no more than 2 households, correct?
That's correct.
Thank you.
Mark, you have a question?
Yes, Patty.
Yeah, well then, what do we do about seating 8 people at a table in a restaurant? I mean, if we're gonna, start reducing these numbers, I think we just stick where it is, be in consistency with the state. I think we'll have better compliance that way. I think we'll have increased non-compliance if we go to 5 people in 2 households. I just think we just do better education on letting people know that there's issues with outbreaks, with small group gatherings in private settings, and that we're going to keep it at 10 with just 2 households. I think, the point about being consistent with the state, that's what we've been saying, and I think we should stick with that.
I can add one more thing to the discussion. This is more anecdotal, but we've seen more severe illness among those who are, infected either via these informal gatherings or a lot closer contact, so even individuals that carpool frequently together. So there does tend to be this association with viral load and the amount of virus that person is exposed to in regards to, outcomes of the disease. We've had a few individuals hospitalized from these informal gatherings, maybe not here, but elsewhere. And so again, that's anecdotal. There's not, we don't have strict evidence to support that, but I think it's one of the things that we're really pushing for, to say that the more that we can try to reduce these gathering sizes, we could potentially, reduce the likelihood that someone has a more severe type infection. Again, I want to just reiterate that is anecdotal, but it's something that I just think we want to keep in mind as we're moving forth with this discussion and considering those things. And especially just looking into the fall when more people will be gathering inside. I think that's just a concern that we have.
And just to
One other-
refute my previous testimony or my previous statement, if the science argues for 5, then I'm all for that. And I also think that 5 sends a very serious message because it is highly restrictive. And that is also something that perhaps we do want to do in terms of messaging. So, I was just offering my other opinion for discussion, but I'm fully in favor of doing whatever appears to be reasonable.
Thank you very much, Brent, for your comment. I'm reading down, Larissa had a comment, and people from different, oops, I lost it. Larissa?
Yeah,
Yeah, I'm just going to address the comment about restaurants, that it actually wouldn't affect the current permissible seated party size at restaurants. The personal gatherings is more of anything that's not already covered under the public health order and that has guidelines in place. So restaurants would still be allowed to have the 10 size limit.
Okay, thank you very much, Larissa. Every one of us are reading the Josh's report every day, and we continue to see the increasing number. And as Karen said, we're moving pretty close to that little orange area. One more day and we may be there, which is going to bring about more restrictions and moving with more strict measures in our community. I would hope that board members would be willing to support staff recommendation, and then in 2 weeks we could see where we are. We got to get a clamp on this and do it sooner than later. So I personally will endorse staff recommendation. So other comments? Suzuho, I think you had your hand up.
Thanks, Marky, and I appreciate you saying that. And it kind of overlaps with what you just said. And our goal is to try and change the path that we're on. We really have this opportunity, as Karen has said, to get our whole community on board and move our path towards the blue instead of towards the orange. We are in day 2 of having our incidence rate in the orange already, which means that if we're there again tomorrow, the state will be reaching out to us to start some conversations around our mitigation strategies, which is why we've also put this document together that Karen just talked through. And our goal is that if we can reduce our group sizes to 5, our informal group sizes to 5, have that be an opportunity to help reduce our outbreaks and our cases that we have seen increase over the last several weeks now. We're hoping that will prevent us from having to go into the orange level, which would require us by the state's guidelines to have a lot more stricter mitigation strategies. So this is really our request to change this one element within our guidelines and our measures so that we can hopefully change the course that we're on right now.
Other comments? Well, we all know that Denver County and Adams County had their restaurants reduced to 25% capacity and their gyms reduced in terms of the number of individuals. I don't think anyone sitting on this board would like to see that happen, because that would be a killer for Aspen and Snowmass restaurants. So any other comments before I ask for a motion?
Marky, Greg here.
Yeah, Greg.
I'm usually very eager to be on board with this. I think what we're doing if we do this is we're going to create as has been mentioned, we're going to create enforcement issues that we simply will not have a handle on. we're going to have people who are violating it twice as frequently, perhaps. I wonder what to do with my friends who might have 6 people in their family. Tell them, send their child away. I'm having trouble with this one. If it looks like we're headed toward the orange zone and the state's going to crack down anyway, that tells me that we stay with the state order and we inform the public that this is where it's going. But I don't understand how just reducing our informal order to 5 is going to have any significant effect, especially when 10 people can get together in a restaurant and, as we see, and commingle as people do in restaurants. I'm not sure I understand here. So we're complicating it. I would almost rather just have a huge public relations push to warn people that, hey, we see this coming down the road. Be very careful. This is what we're observing happening. But I'm not sure creating a new order which will confuse people is going to really have a helpful effect. I'm skeptical. So I guess I'm siding with Patty on that, only that I keep thinking we made all that effort to align ourselves with the state, and now we're deviating again. We can certainly do a PR effort, though. I think that's what I'd suggest.
Well, you got about 1 day before we go into the orange zone, so I'm thinking you do both PR effort as well as decrease, but I'll listen to other members of the board.
Hi, Marky, this is Linda. I agree that we should probably get stricter before we become more liberal. We have the holidays coming up. It's going to be a real issue. People are going to definitely want to get together during the holidays, and I think we're going to see our numbers really go up. So I agree that I think we have to get stricter for a period of time before we then align with the state.
Marky, can I add in again? Sorry.
Well, yeah, I had Ann's hand up first, so I need to call on Ann, then I'll come back to you, Patty.
Thank you.
Yeah, thanks, Marky. Actually, to Greg's comment, I think Josh made a very good argument, had good information to back up the move to 5 people from 10 people. I mean, it's great now that we have that data from the contact tracing and that he could come up, put it together to back this reduction. The other thing, and I'm going to sound a little bit cynical, we have tried so hard to educate people. It doesn't, maybe it's working for some groups, but it's not working for more groups. And the situation is getting very scarier and scarier. I think we have to be as aggressive as we can. And enforcement's always been a problem. I wouldn't want to not support this because I was worried that we couldn't enforce it. There will be people that will adhere to what we're saying. There'll be others that don't. And that's what we're living with.
Patty?
Yeah, enforcement, Ann, is an issue. That's why we've had the issue with 10. But I'd like to know how many of those contacts of group sizes 10, how many were more than 10? Like the 70-person wedding in Wooding Creek was definitely more than 10. So see, that's an issue to me. It is, and Ann's right. We can educate till we're blue in the face, but where does it get us? It's the fact we can't enforce this. And I think we'll just have more violations. We can't go to people's homes. Do we fine them? Do we slap them on the wrist like we did at Bootsy Bella? I mean, I just don't know. I think Greg and I are, I think in the same place with this. I think we're going to have to educate the public on the 5. I think it's a better thing to educate them on the 10. And Marky, regardless of what we decide today, our numbers could go up tomorrow anyway, because we can't implement this by tomorrow. So I just have a concern. I think, we've had this mantra of staying consistent, trying to align with the state, and now we're deviating from that.
Other members of the board?
I have a question for Josh. How many of those groups came for more than 2 households? How many households were involved in these outbreaks?
Yeah, all of them had more than 2 households. I know 2 of them for sure. It was we had 4 households at one, 6 households at another, and the other one I can't remember, but it was right around the same, probably 4 or 5 households.
Thank you. Bill, you had your hand up.
Yeah, I think the challenge that we're going to face with our neighboring counties is that if we're going to have differing rules than say Basalt, it's going to be challenging from one side of the street to the other. I agree. I think that aligning with the state is probably the better way to go. And I think really enforcing the 2 households is going to be the best way for us to get the messaging out to really help people understand that we're getting serious about this.
Suzuho?
Yeah, so I think the 2 household is a non-negotiable. That is a state policy that they've put out. So that will stick regardless of our group size. I just want to kind of clarify that. And then in regards to sticking with our neighboring counties, it's a good point that's brought up. I think one of the things is based on the state dial, every county will be shifting. So Garfield has been in the orange for longer than we have now, and they are currently having conversations with CDPHE about their mitigation strategy. So if any of our counties move to that orange level, we will be restricted down to the 5. So this may happen regardless of whether we decide to do it today or not.
Eagle, where's Eagle, Suzuho in terms? Are they in the orange as well? Because we see the number of cases rising there too.
I'll need to double check that one. I know their cases were increasing as well. I don't believe they're in the orange. I don't think they're having conversations with CDPHE at this time.
Curtis shaking his head.
Yeah, Eagle resident, I was looking this morning, they're not in the orange yet. Yeah, but their numbers are rising. That's correct.
Okay, we need to get a motion on the table. So any further dialogue before I call for a motion on which way you want to go?
Well, I think if we're going to err, we should err on the side of conservatism. If we're in that range and you're debating basically life or death for some, seems to me that that adds to the bias of being overly conservative versus the other.
Okay, did you want to make a motion accordingly, Brent?
Yes, I guess I make a motion that we reduce the gathering size to a limit of 5 and coincide with the state relative to 2 households, either, no matter how you state that, so they're not mutually exclusive, but 2 households maximum and no more than 5. I guess if they're related, how is that incorporated? If you have a family that's, bigger than 5.
Families are excluded from this.
Okay.
So if you're a family of 6 or a family of 8, you can
2
still-
non-related, right?
Yeah.
2 non-related households and an absolute limit of 5. That's certainly going to send a very serious message, and maybe that's what needs to be done. Besides the actual configuring to 5, this is a big statement.
Do we have a second? Linda has her hand up. Okay, further conversation. One of the things.
This is difficult.
I did have a
This is difficult because these kind of measures and these kind of actions don't necessarily directly relate to solving the problem. I'm glad that we're looking seriously at testing, because testing is something that can allay a lot of the fears that go along with this. I'm going to support this today. We have Halloween coming up this weekend. We can revisit this in 2 weeks. I don't think that this is a cure for us. I totally agree that we need outreach and education more than ever. But my hope is that this is a 2-week measure. So my question to everybody would be, if this is a 2-week measure, is that worth it to you?
Greg?
If I could amend Tori's to say perhaps this would call for a meeting next week. This is a pretty drastic measure. We're gonna get some intense feedback as we're getting for the various things we do, which people disagree with. I'm just wondering if we should just plan a special meeting for next Thursday now, or the Board of Health, as we go into this, so that we can be reactive or proactive, perhaps, just so we're prepared, because I think 2 weeks may be too long.
Karen?
I just
Or Suzuho?
Karen, do you mind if I say something real quick? I think one thing that we've been saying since March is that the life cycle of this virus is 14 days. So for us to make a measure and then see the impacts of that measure, a week won't allow for that. So just keeping that in mind when you make the vote and then think about when you want to circle back.
Yeah, I was just going to add too that this is one element of the mitigation plan that we've put together. So there are many other, that document had many other pieces that we are going to put into play pretty quickly. It doesn't matter if the state has said we need to mitigate or not. We feel like the numbers are trending in the wrong direction and that we are going to be in orange very quickly. And so we want to make sure that we're trying to get our community in the right direction. We're at a fork in the road. We want to get to the other path. So we're going to do a lot of those other mitigation strategies regardless. This is one element of that mitigation strategy.
Thank you, Karen. Greg, I appreciate your request for a meeting next week. I like to be reminded this is a 14-day issue, so we'll revisit it in 2 weeks. Okay, I'm going to call for the question because we got another presentation yet. We have a motion on the table. We have a second. All in support of following the staff recommendation, raise your right hand. Suzuho, did you get that? In terms of Jeannie, were you? Yes.
I think we should stick to 2 households and stay with the state to not make things confusing for now.
Well, okay, thank you very much. Those who are not supportive of the motion, raise your right hand. 1, 2, 3.
Looks like the motion's passed. So Linda, Marky, Tori, and Brent voted in support of the motion, and then Greg, Jeannie, and Krista voted against the motion.
Okay.
One vote I got incorrectly.
Well, since Linda voted, Krista cannot vote. Is that correct?
No, we have multiple at-large positions. So that's, yeah.
No, sorry, Krista. Oh, yeah. Just making sure we're counting our alternates. Let's make sure we're clear about this. Yeah.
Okay. So Suzuho, did you catch the numbers? It did pass?
It did pass, yeah.
Okay. Thank you very much. I'm sure we'll hear from some of our individuals in the press and from members of the community. And I really want to thank all of you for this conversation. It was spirited. It's important that we have these conversations. We'll see where we are in 2 weeks from now. And I know that everyone sitting on the board really does represent a constituency. And I think one of our jobs is to be ambassadors for decisions made at the board level and be what I call the ambassadors of public health. So thank you all very much for this conversation. And with that said, Karen, the next presentation.
Sure. So again, our last, this is Jean. Thanks for joining us today from Garfield County Clerk and Recorder. Garfield County has had a contract with us or an MOU with us for a number of years around vital statistics. So that's birth and death records. And per our contract with them, we have asked them to do a presentation once a year to the Board of Health so that you're just aware of the contractual work that they're doing and kind of the themes and salient pieces, Jean, that might be really important for the Board of Health to be aware of with birth and death records. So thanks, Jean, for joining us today.
Okay, well, Jean can't make it today. I'm Edna Place. I'm her chief deputy, and with me I have Maria Gornick, who is the vital records employee that does 90% of the work back there. So Jean said she sent you numbers for last year for 2019. Is that what we're focusing on, or what exactly are you asking for?
Yeah, so we wanted a report out on the numbers and if there are any kind of salient trends that you're seeing in Pickens County around, death records or things that you feel like are important for a board to understand, a Board of Health to understand.
So in 2019, we issued 471 birth certificates. And
Up to date today, we did one set.
And then today, up to date for 2020, we've issued 317 birth certificates. For the death certificates, we haven't issued very many death certificates.
We've issued maybe 1, 2, 3, for 4 persons that were deceased. They got them from us, and then 1 passed away in Garfield County, but they used a funeral home in Grand Junction, so they purchased the
We're looking at Pitkin County stuff.
right. No, and he passed away, so they got him in another county. The birth certificates are the ones that we do more than we do death certificates. And right now with the COVID, we are actually doing everything by email and by mail. And then we have drop-off boxes that, people can do it, drop it off if they live here. The majority of birth certificates that come from Pitkin County, they're doing it by email, and then we just put it in the mail. And we have, we're willing to, if they need it right away, as long as they submit everything prior to them coming, they can definitely come and pick it up. And then they just call us from the bottom floor right before they come through security. And then we walk down the birth certificates that they've requested. There's been several of those that we've done just recently because they're traveling or, they're trying to get their passports. So, we're really trying to help them out simply because they can't just walk in and be able to request what they want. But it seems like it's, people are pretty happy when they know that they can pick it up.
Does everybody understand the security that goes through with the birth certificate and death certificate paper? We have to have a vault that does not have any outside access, no windows, no nothing. It's an enclosed. They can't get through it through the ceiling and stuff, that we have to keep all the vital record paper locked up. And we only get out what we need for the day. So it's very secure. The state double checks our numbers to make sure we're not missing anything like that. Any questions?
Any questions?
Jean, I have a question for you. Death certificates require a physician's signature. How are you getting the physician's signature all coordinated through this entire process?
We actually do not have to do that. It's EDR is what they call it, the electronic death records. I believe that a lot of Pitkin County may do everything electronically with the funeral homes. The funeral home starts it. And then they send it to the physician to sign electronically. They get it back. Everything's just more or less electronic until they request the death certificate. And that's through the state. Everything has to be approved through the state and finalized through the state before we can issue the death certificates.
Okay, thank you. Other questions? Okay, I don't see any board members' hands going up. Thank you, Jean.
Okay, you guys have a wonderful day.
Okay.
Thank you.
Marky, if I can take.
Marky, you're muted.
Now we've got 10 minutes for round robin. Tori?
Quick question on the limitation that we just put in for 5-person gathering. When will that go into effect?
We have the public health order revised just based on what was going to come out of this meeting. So we're ready to put it forward. So we were thinking in per the board's perspective on this, we can do it as soon as tomorrow, or we could wait till Monday to do a little bit more messaging around it.
For me, part of my support was about this weekend and this Saturday and Halloween gatherings. So I would be supportive of putting it in place before the weekend, even though that poses challenges for communication. That's truly the aim. I just also want to just say for the record, to be clear, I'm supporting these greater restrictions in the hope of preventing even greater restrictions. If we can get a call out to our community that says that this is where transmission is happening, then maybe we can avoid our restaurants having to limit their capacity and other restrictions that may be coming. So a difficult vote for me. I just want you to know that, but I would support it being in place as soon as possible. And that's going to be a difficult one for Saturday.
And Tori, the one last thing we had on the agenda was that there is the opt-ed that we have penned with other partners in this community, other organizations, Aspen Skiing Company, City of Aspen, Town of Basalt, Pickens County, the school district. And we wanted to bring that to the Board of Health to see if you all wanted to sign on to that as well. I attached a template in the packet. We've revised that version since then, but that's the last thing for the board to kind of weigh in on today. And it's exactly what you're saying, Tori, of making this statement and saying this is a crucial time right now before Halloween.
And I don't know how you say it exactly, but and correct me if I'm wrong, but the reason this thing is progressing, right, is number one, the virus has a mind of its own and is very aggressive, fair enough. But the other reason is a certain lack of compliance. And that if absolutely everybody wore a mask 24 hours a day, including while they sleep, and totally honored social distancing, the levels would be hugely less, if not eradicated altogether. So it seems to me that in a diplomatic way, it ought to be said somewhere in an editorial that this is partially due to the fact of a lack of social compliance or a relaxed attitude. And that maybe that would help in some way. I don't know.
Back to the op-ed that Karen was talking about. Karen, if you've updated it, would it be helpful that the new one go out and we would have until tonight?
Yeah, thanks. And Kara, are you on? Because I know Kara's been working with stakeholders to do that revision, and I don't know where we are on it. Can you let us know?
Yeah, actually, I am sending it to the papers based on this discussion this afternoon, and it will go into the papers for tomorrow morning.
I would suggest that the Board of Health sign on to the op-ed. Like some input on that one. Tori's hand is up. I'm supportive.
Did you send that to us?
We can send you the revised version. I'll let you know it's very similar to the one I put in the packet. There's some minor adjustments that we've made, but it's thematically pretty similar.
Okay, can I have a show of hands of those wanting the Board of Health to sign on to the op-ed? Okay. Patty, is your hand up? Oh, okay. Krista?
Alternate. Yeah, and Krista's an alternate. So we have Greg, Jeannie, Marky, Tori, and Brent, and Linda. Are you still with us? Do you have a vote on this one?
Yeah, I raised my hand virtually.
Perfect. Thanks, Linda. So unanimously approved.
Okay. Well, with that said, I've got a dog that is kind of snoring, and so if you hear a dog snoring, that's Bodie. He's fast asleep and he's dreaming. Okay, do we have a motion to adjourn the meeting, because some of us have about a half hour before the next meeting? Sorry. Oops.
Real quick in the round robin round, real quick. Hey, has there been more consideration about the health disclaimer or visitor registry that we've been talking about for a couple months? Are we moving towards that in this winter at all? was counted a story from somebody today that traveled to New York. They got off the plane. They had filled out a health disclaimer. I mean, they were tracked by their cell phone and stuff, but I don't need the technological part of it. But are we still having a discussion about supporting a health disclaimer or visitor registry, or are we not pursuing that? Are we working with anybody? What are we doing?
Marky,
Sure.
I contacted Northwest Colorado Council of Governments. John Stabney was looking into it. The contacts he made so far, nobody had anything that they could document that hotels were using, but he's still looking into it for us. And Tori, you were going to call CAST, I think, or somebody was, to see if CAST had any info. But
Same thing.
CML.
yeah, did you? And so that's where I am on that. I called John Stabney right away, and but so far we haven't turned anything up as far as a document that we could use and tweak over here.
Same with CML.
My question is, why are we waiting for someone else to take the lead on this? We did bring this up quite a while ago, Tori, and I'm embarrassed to say you reminded me, and nothing's happened. And that's actually pretty frustrating. I've been talking about it a lot. If we're going to look to someone else to do this for us, or are we going to try to do it ourselves? I think perhaps we could take the lead here.
We could get a
Greg, I'm hoping that someone from the team can jump in, because I know that they were looking at this info reservation sheet. Larissa, Kara, just if you can weigh in on the community liaison group, and if there's, I don't know where the progress is or what conversations have been had. So kind of putting people in the spot.
It seems a little disjointed to not be tracking at the airport, which seems rational to me. And the European hotels, every last one of them have been doing this forever, and yet we dialed down the the gathering size to 5, which is rather draconian. And you'd assume that we would be consistently as conservative in other places. This is a big hole.
And I'm happy to jump in. I'm going to be quite honest. I just sent you all the op-ed letter, so I wasn't tracking the initial question. So I might be the one with the answers, but I don't know the exact question.
I know, Kara, we had a conversation quite a while ago about the possibility of maybe an affidavit that a visitor coming to Aspen would be asked or even required to submit along with their hotel registration, for instance, just so that we could, so they would understand the liability they assume if they got sick on arrival regarding their hotel bills. And also to give us assurance that they're actually tested and shown to be responsible along those lines. And I think we had a pretty good conversation about it. You'll have to remind me. I hope I'm not the only one who remembers this. Maybe I just thought about it.
And maybe the best is that we could come back with a presentation on that. We've kind of taken a couple different avenues to address that piece. One is with the winter ski area guidance from the state, is that there is information that the ski industry, as well as with our lodging partners, do have to share. And so they are putting that in their reservation systems, I guess. And it might be more in the fine print than maybe the bold messaging that I'm guessing Board of Health is looking for. Through the Northwest COG grant that we did get on a community-wide winter media campaign, I know the team is looking at crafting up what that messaging is, and I know that was also part of the ask in there of how that is being layered in. So maybe the best approach is to bring that back in 2 weeks and share what that full suite of systems are that we're kind of trying to approach that.
And I'd also note that the board had issued a letter looking for visitor requirements at the state level. We did get a response on that. And Greg, that's a conversation I'm recalling around quarantine or testing kind of requirements. We, to my knowledge, did not have direction from the Board of Health around a testing or quarantine requirement specific to Pickens County. And part of the challenge there, of course, is it is so difficult. I mean, I don't know if anyone's driven over Denver lately, but if you have, I'm wondering if everyone checked every individual county's requirements before you did that. My guess would be not, because it's typically easier to message and such at the state level. The state did decline to do that. But as far as, you know, the kind of notice of, hey, here are your responsibilities if you're visiting here, that's definitely something we can have more conversations with the lodging community around.
That would be great. I'd recommend or propose that we ask staff return to us then in 2 weeks, if not sooner, with a draft of something like that.
Yeah, I think Kara offered 2 weeks from now, she'd be prepared to do a presentation. Okay. Is there any other business to come before the board? Seeing no hands, do I have a motion to adjourn? Thank you, Brent. Motion to adjourn. Do I have a second?
Second.
Thank you, Tori. All in support, raise your right hand.
Aye.
Aye.
Okay. Okay, have a good afternoon. I'm glad the sun is shining and the snow
Thank
is
you.
melting.
See you next time.
Later.